Thank you very much indeed for the kind invitation. It's a real honor to be with you here today. So no conflicts of interest for today's presentation. In the next few minutes, I will try to present to you information about the smoking and lung cancer burden in Greece. What is the current state of play in terms of the lung cancer screening initiatives, planned initiatives for the future, and some perspectives on data sharing at the moment. So Greece is a relatively small country, tucked away in the Mediterranean Sea with a population of 11 million. However, we have unfortunately secured a troubling second place in smoking in Europe after Bulgaria. So we've got 25% of our adult population over the age of 15 that are active smokers, so 2.6 million more or less, and there's a high percentage of female smokers, so 1/3 of the female Greek population are active smokers at the moment. And we've got 14% of all deaths in Greece that are caused by tobacco use. So the numbers are quite daunting actually. So among these 2.6 million active smokers we have in the country, we've got over 170,000 people that use e-cigarettes, over 260,000 people that use heated tobacco products, and more than half of our active smokers in Greece have started smoking before the age of 18, so literally during their school years. We do have smoking cessation services, though, in an attempt to cover for these huge problem we have with smoking. So we've got a relatively good coverage in Athens and Thessaloniki with multiple services there, but we've got patchy coverage in the rest of the country with only one service per regional unit. So you can see the green areas are mapped areas in Greece that have smoking cessation services, but actually outside Athens and Thessaloniki, there's only one unit per region, which means that people need to travel a lot. We don't do virtual clinics. The Greek legislation needs to be reformed in order to be able to approve that. And we've got over 6,000 islands with no cover whatsoever in terms of smoking cessation services. In terms of lung cancer, we've got roughly 9,000 new lung cancer diagnoses per year and more than 7,000 deaths due to lung cancer. And males rank 4th in Europe and 8th in the world in terms of lung cancer diagnosis. So the numbers, again, are daunting, similarly to the active smoking population numbers. Lung cancer, well, is among the most frequent cancers in Greece and among the most fatal ones. And to be more accurate, it's the second most common cancer for both sexes in Greece, following breast. And it's the most fatal one for the Greek population, and it's followed by the colorectal and breast cancer. And based on our national registry data, over 60% of patients are diagnosed at an advanced stage of the disease. So radical treatment options are not pretty much of an option at that point of presentation. In Greece, we do run national screening programs for cancer. So we've got a national breast cancer screening program, we've got a national screening program for colorectal cancer and for cervical cancer. And just to remind you of the previous slide, so we do have national cancer screening programs for colorectal and breast, which is the second and third most fatal cancers, but we don't have a national lung cancer screening program for lung, which is the deadliest cancer of all in Greece. We have acknowledged that within the Hellenic Thoracic Society, and back in 2021, we took the initiative and we formed a national task force for lung cancer screening with an attempt to offer national lung cancer screening guidelines and a framework and push the Ministry of Health to implement national lung cancer screening. So we brought everyone together, specialists from the Hellenic Thoracic Society with a special interest in lung cancer, in smoking cessation, in primary care. We took on board thoracic radiology experts from the relevant society, thoracic surgeons. We had on board the official representatives of all the cancer patient organizations in Greece. So with the first time ever in the country, we brought everyone together in an attempt to push things forward and cover this huge problem of lung cancer screening in Greece. We took the blessings of the National Society of Medical Oncology and of all the social organizations, and we have good representation from several regional units across Greece. The majority of us are respiratory physicians. We do have radiologists, thoracic surgeons, clinical nurse, specialists, oncology nursing, and we do have 5 doctors in specialty training because it's always very important to have the early career members on board. So what we did is we developed our own national lung cancer screening guidelines. We developed a standard operating procedure and a quality assurance scheme for the implementation of lung cancer screening in Greece. We have just completed a dedicated lung cancer screening training program for healthcare professionals, and throughout the whole process we're trying to raise public awareness, and we do very strong advocacy for lung cancer screening implementation in Greece. So this is the backbone of our national lung cancer screening guidelines, which was published in the European Respiratory Review back in November 2025. And just to summarize, we have included in terms of eligibility criteria participants aged 50 to 80 years of age, active or ex-smokers at least 20 pack years, and up to 15 years of since they stopped smoking, no documented diagnosis of cancer in the last 5 years. And we have a biennial low-dose CT with individualized risk stratification, and then this can be adjusted to annual screening for the high-risk individuals, and there is always direct access to smoking cessation services. So this is our national guidelines and standard operating procedure framework. This is a very busy slide, so this is just to show you that we have included the way the participants are going to be recruited and approached, all the prerequisites and standards that need to be in place for the centers, for the infrastructure, for the human resources, all the technical and operational requirements, the QA scheme, the way the whole process is going to be managed and coordinated. And for the first time ever, we have a participant pathway for the future implementation of lung cancer screening in Greece. We did a very nice press conference. We submitted all this to the Ministry of Health, and that was almost 18 months ago. And since then, we have also completed the dedicated lung cancer screening training program, which is going to lead to an accreditation, and it's going to be renewable. And it consists of 2 parts. So the first part applies to all the primary care physicians that are going to be involved in the recruitment, and part B is going to involve the specialists that will be working in the lung cancer screening centers. And there's going to be participants' education through the patient organizations as well about the efficiency of lung cancer screening. We've done cost-effectiveness studies, and we showed that lung cancer screening is effective in Greece. And following 18 months of complete and almost weekly, let's say, poking of the Ministry of Health, we finally got an official announcement that the Greek Ministry is going to start a nationwide lung cancer screening program in 2026, since they have managed to secure funding and they have managed to be convinced by us. In terms of current screening activities in Greece, we have been one of the first countries which joined the SOLAS program under the auspices of the European Respiratory Society. We've got 3 recruitment centers, one in Thessaloniki, one in Athens, and one in the island of Crete. And we do have lung cancer screening clinics, so in Athens, in Thessaloniki, and in 3 other areas with a relatively good geographic, let's say, representation, but still there's much work to be done. Hopefully the National Lung Cancer Screening Program is going to help in the enrollment of the screening across the country. The oldest screening clinic that we have is at the Sotiria Athens Hospital in Athens. It was established in 2022, and essentially it offers the idea of one-stop shop. So participants come, they get their low-dose CT, their smoking cessation access on the very same day. They do have lung nodule access on the very same day if it is required, or lung cancer clinic on the same day if it is required. And this service is linked directly with cardiology and COPD services. So we try to offer an integrated approach. And while we're waiting for the national program to be rolled out in 2026, we did an exercise and we tried to map the actual lung cancer pathway in Greece at the moment. And we did find there is a lot of heterogeneity, there is a lot of fragmented care, access inequalities. People tend to self-refer without going to the primary care physician first. So now, last month, essentially, we started a new national task force where we're going to consolidate a diagnostic pathway for lung cancer in Greece. And again, for this one, we have brought together the national societies for respiratory medicine, for radiology, thoracic surgery, nuclear medicine, oncology nursing, and the National Cancer Patients Organization. So it's all about bringing everyone together and push things forward. So to summarize, in Greece, we're going to have a national lung cancer screening program that will start in 2026. There has been an official announcement from the Ministry of Health for that. We've got a Hellenic National Task Force on lung cancer screening, which has ensured we've got our national lung cancer screening guidelines that are tailored to the actual epidemiology and burden of lung cancer disease in Greece. We do have an operating procedure and a QA scheme in place, and we do have a lung cancer screening training program to ensure sustainability and implementation. And we've got a new task force on a national level to consolidate a diagnostic pathway for lung cancer in Greece. Thank you very much for your attention.